Hi, today we're going to talk about stroke and 11 early warning signs you would experience days or weeks before the sudden onset of stroke. So imagine you being able to identify these early signs earlier on and preventing their sudden occurrence. It will save you a whole lot of trouble. And I've had a number of patients who started experiencing something funny in their bodies and decided to look into. And when we did our issue taking, our physical examination investigation, they turn out to be warning signs of stroke, and we're able to deal with the situations immediately and effectively. And most of these clients are older adults, though it can also happen to the younger ones, so the younger generation is not left out. And stroke is a medical emergency involving damage to the brain from interruption of its blood supply that affect the different parts of the body. There are major risk factors of stroke, and some of them include high blood pressure, diabetes, high cholesterol, embolism, obesity, heart disease, smoking, and alcohol. So let's identify these early warning signs from my experience with patients. Number one is high blood pressure. High blood pressure is a major risk factor that can lead to blood vessel damage in the brain. And some of the common symptoms of high blood pressure include dizziness, headaches, nosebleeds, sensational movement in the head, and you can tell from body experiences if these symptoms suddenly occur if it is high blood pressure, and of course multiple reading of a blood pressure with a machine. Now, you may not have been hypertensive prior to these symptoms, but one major factor of you getting high blood pressure is age. As you get older, there's the likelihood of you getting high blood pressure, and that is why it is very important that every home should have a blood pressure machine, whether there is hypertension or not. The second early warning sign is sudden numbness, weakness in the limbs, and the tingling sensation in the body. Numbness in the face or the limbs and sometimes pain and needle sensation can be an early warning sign of stroke, which indicates blood flow obstruction to the extremities of the peripherals and a damaged nerve in the brain. The next on the list is heaviness in one or both limbs. You see, the feeling of heaviness in the limbs, especially the lower limbs, can be an early warning sign of stroke from blood flow obstruction to the limbs and the imbalance in the brain coordinating centers. The next is loss of balance. A damage to the brain coordinating centers can lead to loss of balance and movement. Example of the symptoms include muscle weakness, certain ear problems, especially reoccurrence, dizziness, and the dragging of the feet. The next early warning sign of stroke is sudden headaches. A severe headache or a severe unexplained headache can be an early warning sign of stroke and the feeling of movement in the head. Then there is chest pain. A disruption of blood flow to the heart can be an indicator of stroke. Remember, the heart is responsible for distributing blood to the brain, and if there is an obstruction of blood flow to the heart, it can present as a chest pain. And once there's obstruction, your brain is depleted of blood flow and oxygen, and that can be an early warning sign of stroke. The next early warning sign of stroke is vision problems. Sudden acute blurred vision, double vision, or loss of vision in one or both eyes could be an early warning sign of stroke as an indicator of obstruction of blood flow to the brain because your optic nerve connects to the brain. The next is fatigue. Fatigue is often an overlooked sign of an impending stroke, and mostly we attribute it to the common causes such as the lack of sleep, stress, and poor diet. But fatigue with no particular cause could be an early warning sign of stroke, especially if it is sudden and persists for a while. The next early warning sign is memory problems. A disruption of blood flow to the brain can lead to difficulty in concentration, confusion, and forgetfulness. And these episodes are normally on and off and could be an early warning sign of stroke. The next is difficulty in speaking. A damage to the nerves responsible for speech will result in sudden difficulty in speaking. And when you do notice any changes in your speech, it could be an early warning sign of stroke. And lastly, we have nausea and vomiting. Sudden persistent nausea and vomiting, which persists even after taking medications, can also be an early warning sign of stroke. So these are the 11 early warning signs you would experience days or weeks before the sudden onset of stroke. And if you do know any other warning sign that I didn't mention in this video, kindly tell us in the comment section of this video. Identifying this and going to the hospital earlier will save you from trouble and will save your life. If you want to know the warning signs of a silent heart attack, I'll put the video right here. Check it out. Hey, always remember that that God wants you healthy. Your health, your life.